Good morning, everyone. It's Saturday. Yeah, we haven't got anything starting for another like 30 minutes. I might get a ticket here in the next 15. But I just was sitting here entertaining myself because he had me come in at 4. Why? Anyway, we don't got to be on the job until 5, and it's like quite literally like right up there. So, anywho, I was watching the channel is called Yak Motley, and the guy is he's kind of talking in regards to the medical industry. They're not talking about all the practitioners that are peacing out. They're like, we're done with this shit. It's sad. I worked in the medical industry. Dental laboratory technician. I chairside assisted. I worked with a dentist. I worked with a dentist as a civilian. Worked in the dental laboratory as a civilian. And understanding, I had a lot of friends that were like in medical, like medical assistants. I had friends with nurses, doctors, practitioners, stuff like that. Yeah, I have a very broad spectrum of interactions and acquaintances within that industry, and not to mention my son-in-law is currently in residency. Now, his father is a doctor. His brother is a dentist. We can talk shop because I understand the terminology and all the crap, right? So, anyway, that is my biggest fear because he is such a good person. I mean, my son-in-law is like the nicest, most kind-hearted, decent individual that I worry about if his moral ethic is going to persuade an indifference to his career, and he is already $400,000 in debt. And my daughter is part of this equation. So yeah, I worry about them like insanely. He's so level-headed, and the concerns that I have is that he will get to a point where this is, I should have chose, he was going in audiovisual, like movie directing, editing, producing, things like that. He's got skills, better skills than me. And here I got the channel, and I just rant, and I put human perspective out there. The perspective of if someone had given a comment, I don't know if I'm your targeted audience. My targeted audience is anybody who's going through some shit, who needs a perspective, either to help them be like, well, maybe I'm thinking it wrong, or maybe, yeah, okay, I'm not alone. Am I looking at this indifferently, or, am I right? Or maybe I should rethink. And, God forbid, shit, I hope nobody's gone through the same shit that I've gone through. And if they have, my heart goes out to you. And if what I put out, and I'm, talking about it, and got the audacity to talk about some of it, inspires you, to helps you to work your own shadow work, in some way, shape, or form. Conversations in my family always, someone will have something happening at work, and it wasn't a, was I wrong? Should I maybe have done this something different? and there's no compassionate reaction to it. It's either, you're a fucking idiot, or they one-up you. Oh, well, this is what happened to me. Yeah. And now, my mom, she doesn't like to one-up, but she likes to compare. Like, she has similar situations where, yeah, that happened to me once. Now, I talk about the narcissistic abuse and things like that. There are a lot of people who are dealing with this type of shit. And the only reason that word is getting thrown around all over the place so heavily now is because it's coming out of the woodwork. Because there's couples, and it's male and female, who have endured this. And it has been going on in the shadows for decades and decades and decades. Even centuries, probably. And it just goes for saying, if you know somebody who, yeah, they were with this person and now they've shut down and they're not talking to you, and they say, oh, he was abusive, and you're like, well, I never had a problem with him, you might want to listen. Because what you see in public is not always what's happening at home. That is the purpose of this channel. It's like, yeah, you've got a friend, or maybe you got a family member. They're going through some shit. Or they shut down and they don't want to talk to you about it. The reason why they're not talking to you about it is because you're not listening. Or they don't feel comfortable. They don't think you're going to listen. Or you're not going to listen without a response. Or an understanding, or even a compassionate hug. That kind of thing. I think about how many victims there are from this one individual. It blows my fucking mind. And of course, I find all of it out after. And then now I'm like keeping track. Okay, yeah, this one, he just fumbled after me. Now he's got a new one. I got all this information after I got my head out of my ass, and I compared the notes with the baby mama. And yeah, he told me a lot of it. He only told me half of it, though. That's the distinction with the narcissist. They only tell you half of the story. They're not telling you all the dirty shit. It's when his lies started to unravel. The math wasn't mathing. The stories weren't lining up. He started to get nervous. And he started to push away. Because one day, I was going to find out the truth. And I did. So about this issue with the medical industry, it's kind of the same. It's a parallelism, I guess. The people who aspire to help people, they go into this field of work, they get locked into $400,000 or $500,000 in debt. They go through shitty fucking hours in residency. It's like my son-in-law is working some of the most stupid fucking hours. And he has to maintain, now they have a new baby, maintain his sanity through that atmosphere, and then carry all of that information and come home and take care of my daughter and their new baby, pay the bills, and they don't get paid shit. I mean, what these residents get paid is It's absolutely fucking pathetic. I think kids at McDonald's earn more than what these residents are getting. And that is just, that's repulsive. I can't even, there's no word. Abhorrent. Pick a fucking word. So with that, you know, I worry. I worry that, you know, because he's got a good heart, he's going to get sick of the shit and go into something else. I'll be all supportive of it, but the student loans still got to get paid. It's heartbreaking. It's one of those things that I worry about, because I know how the medical industry is, and I know what they are taught in school, and I had been in that field of work, and I know what burnout looks like. And, you know, from the dental perspective, we had a dentist who was the most, oh my fucking God. Oh, he was a butcher. He was a fucking butcher. There was another one up in, you know, at another post where I learned how to do ceramics. This guy was a fucking butcher. However, most of the other ones that I had worked with, they knew their strengths and their weaknesses, and they stayed away from their weaknesses. And they didn't have, you know, raging egos that, like, yeah, I'm gonna do this because I think I'm the best at it. No. And we had some of the best prosthodontists I have ever fucking seen in the military. We had this one dentist, he was just absolutely, his shit was like textbook fucking perfect. He was my colonel. I loved him. Him and his wife, it was like they were close. They were more family to me during that time in my life than my own family was. And he did the most amazing work. And I would sit there and think about, it's like, God, if he were to ever retire from the military and get into a private practice, after I had gotten out of the military and went into and worked for someone in private practice, she was a butcher. You see, in the military, I had the added bonus of being able to be in the laboratory and actually see my work get seeded into someone's mouth. I was able to work chairside with the dentists and help them with my job, you know, doing impressions and, you know, assisting and being able to see and helping them with shades and shit like that. I was all encompassed, hands-on. And when I got into the civilian bracket of it, I was strictly either a dental assistant with no interaction with the dental laboratory, or I was a dental laboratory technician with no interaction with the dentist. And it was isolating, and I didn't like that. I liked that all-encompassing atmosphere where I could be involved with the patient care as well as be in the lab fabricating the prosthetics, right? That kind of thing. I liked that, you know, interaction. I wanted to know who the patient was. I don't know. It was just a completely different environment, and it's turned my stomach, you know, getting into the civilian world, the whole twisted derangement of difference that I had to, I was totally turned off by it after a while. It's like, no. I mean, do I have the skills? Yeah, I could probably whip up a set of dentures. I could probably wax up a crown. I could, design it, do a diagnostic wax up for somebody who's getting a reconstruction. Because there are such things as a full crown reconstruction from somebody who's like bulimic and their stomach acid ate off the backsides of their teeth kind of shit. Yes, I've done those. Wax up reconstructions. Done an impression of it because that's what she wanted, and then handed it off to the ceramic guy. The ceramic guy could fabricate the porcelain to look exactly like my wax up. That kind of thing. But yeah, all the facilities, they worked in different, attitudes are different, whatnot. But the thing that I worry the most is if he has a change of heart in that field of work, what will happen to him and my daughter? And how will it affect me in the long run with that respect? Insurance is stupid. Our medical care is so fucking deranged. The information that they're making doctors sell it's malpractice in itself. The research is all extrapolated and it's biased. So whoever is funding it, it's going to facilitate their point of view as opposed to actually doing research and or coming up with a result that contradicts whose money it came from that funded this whole project. Yeah. It's crap. And there's a lot of young people who have gotten into that field of work who are like, you know what, this is bullshit. I'd rather flip burgers than deal with this crap. And with the technology and the information that we do have now online, a lot of people are educating themselves. Now, they're not paying the $400,000 to get the formal education, but they're digging in and they're racking their brains and they're learning this to take care of themselves, because the health care and medical system that we have in this country is so twisted. It's like the insurance company has the last say as to whether or not you get a procedure done. What the fuck, Chuck? Yeah. The doctors, got the same complaint. They're like, who the fuck are they? They didn't go to school for this shit. I'm telling you, this person needs this. And the insurance doesn't want to pay it. So the person can't get the procedure. If they want to get it, they got to pay out of their own pocket. Why the fuck do you have insurance? That kind of thing. So yeah, there's a lot of people out there who are leaving the industry based on moral ethic. And yeah, and it's sad. It's very disheartening. So yeah, Yak Motley, he's, those little excerpts and stuff that he has discovered, yeah, he's on point. Yep. The people who are the dentist, yeah, she's on point. People are assholes. In the industry in itself, the insurance and the whole system, it's almost like it's rigged for failure. And these poor doctors, we need doctors, we need surgeons, we need people who know what the fuck they're doing. And it's like the whole system in itself, encompassing, is designed to run them off. When you run out of doctors who actually give a shit, there's a lot of doctors are getting out of this because they realize what they're fucking being told to sell is bullshit, and morally they can't do it anymore. So they're like, I'm gonna go out on my own and be a holistic practitioner or something. They try to get out of that whole idea under the mainstream medical, that Rockefeller institution thing. It's absolutely sickening. And one of my in the back of my head, that stress, as I worry about my son-in-law and my daughter, and knowing him. I hope he's successful, but my greatest fear is that he's going to be like this. Yeah, I should have gone into movie producing. Which he still could. It's not a long shot, and it's not a pipe dream. But anyway, I'm going to get off here. But yeah, check out that video. If you're wondering what's going on with our medical system, yeah, it's the stuff they're not talking about. Doctors are packing their bags and being like, peace out. Alrighty, have a great day. Bye.